Funding and support for this project has been provided by the State of Washington Department of Labor and Industries Safety and Health Investment Projects under award number K4670.
It takes a lot of hardworking people to bring the world's best fruit from the orchard to the packing house. There are challenges to staying healthy throughout the year. Most everyone has suffered from colds. We all know fall and winter are called the flu season. And of course, COVID has touched all of our lives throughout the world. Many of us go years without missing work or family time due to illness. But it's not because of luck. People who are able to stay healthy are using skills they've learned to prevent illness where they work and live. In the next few minutes, I'm going to help you better understand the infection risks we all face, indoors or out. Here's what you want to pay close attention. There are proven ways to prevent illness, and you, your coworkers, and your family can use those methods to avoid sickness and disease. So where do we begin? Of course, we use the most effective tool we have to prevent illness. We wash our hands. In the next 20 seconds, I'm going to show you the right way to prepare your hands for work. This is how you wash your hands. Soap, water, and plenty of scrubbing. From fingertips to wrists will make these valuable tools safe and ready for work. And it really does require 20 seconds of scrubbing. Using a special gel, this ultraviolet light allows us to see whether we've properly cleaned our hands. It's clear that 20 seconds of scrubbing is what's needed to prevent illness. This soapy water may be sending all sorts of pathogens down the drain. Pathogens are germs, tiny living organisms. They can be bacteria, viruses, parasites, or fungi. Germs can cause infectious diseases. And the bad news is, they can spread easily from person to person. Hands aren't the only way germs spread infectious disease. COVID-19, flu, and colds are caused by pathogens that also spread through the air. E. coli, salmonella, and norovirus are germs that cause diarrhea. They are typically spread by direct and indirect contact. Insects and other animals may also carry disease and infect people. The pathogens we're most concerned with in the orchards and packing houses include norovirus, E. coli, salmonella, flu viruses, and of course, coronavirus. COVID-19 has resulted in more than 1 million American deaths since early 2020, with nearly 100 million reported cases. More than 200,000 Americans are hospitalized every year because of the flu. In 2021, more than 250,000 people were infected with E. coli, resulting in over 100 deaths. And on average, every year, hospitals in the United States treat more than 400,000 norovirus patients. About 900 die. We've just seen a lot of numbers. But of course, these numbers are people, like your family, your friends, even you, who may suffer and maybe die from diseases we can all prevent. We started this program by washing our hands. Let's finish with a handful of other ways you can avoid giving or getting illness at work. Wash your hands until you know they are clean, before work and during breaks, after going to the bathroom, before eating or drinking, and after you remove your gloves. If water isn't available, use an alcohol-based hand rub. Cover sneeze into your arm and certainly away from people and food areas. Wear a face mask if it's required or if you feel the need. If you receive even a minor cut, cover the wound and tell your supervisor. Clean and sanitize any tool or equipment that may have been contaminated with blood and discard any contaminated produce. Pay attention to your body and any symptoms of illness. If you've got a stuffy nose, cough, diarrhea, headache, or have vomited, tell your supervisor you're not feeling well. They'll help you determine if you should stay home. No one wants to suffer illness, especially while trying to be productive at work. You now know there are a number of pathogens we all need to avoid. More importantly, you also know how to prevent getting sick or spreading illness. And now, let's all wash our hands and get to work. Thanks.